Geneva, launching a policy brief on COVID-19 and mental health, Secretary General Antonio Gutierrez said the virus is not only attacking physical health, it's also increasing psychological suffering. Joining us live from Geneva is Jim Hipolito. Hello, Jim.
Hi, Alma. Here's an update from the United Nations here in Geneva. The United Nations said decades of neglect and underinvestment in addressing people's mental health needs have been exposed by the COVID-19 pandemic. Spearheading the alert ahead of the upcoming World Health Assembly in Geneva, United Nations Secretary General Antonio Guterres urged the international community to do much more to protect all those facing mounting mental pressures. Let's listen in.
But the COVID-19 virus is not only attacking our physical health, it is also increasing psychological suffering. Grief at the loss of loved ones, shock at the loss of jobs, isolation and restrictions on movement, difficult family dynamics, uncertainty and fear for the future. Mental health problems, including depression and anxiety, are some of the greatest causes of misery in our world. Throughout my life and in my own family, I've been close to doctors and psychiatrists treating these conditions. As Prime Minister of my country, Portugal, and as a Commissioner for Refugees, I became acutely aware of the suffering they cause. And this suffering is often exacerbated by stigma and discrimination, what is absolutely unacceptable. After decades of neglect and underinvestment in mental health services, the COVID-19 pandemic is now hitting families and communities with additional mental stress. Those most at risk are frontline health workers, older people, adolescents and young people, those with pre-existing mental health conditions, and those caught up in conflict and crisis. We must help them and stand by them. Even when the pandemic is brought under control, grief, anxiety and depression will continue to affect people and communities. This is the background to the policy brief on COVID-19 and mental health that we are launching today. Mental health services are an essential part of all government responses to COVID-19. They must be expanded and fully funded. Policies must support and care for those affected by mental health conditions and protect their human rights and dignity. Lockdowns and quarantines must not discriminate against those with poor mental health. As we recover from the pandemic, we must shift more mental health services to the community and make sure mental health is included in universal health coverage.
According to the UN guidelines, depression and anxiety before the COVID-19 pandemic cost the global economy more than $1 trillion per year. Depression affects 264 million people in the world, while around half of all mental health conditions start by age 14, with suicide the second leading cause of death in young people aged 15 to 29. The UN paper also highlights a warning from the Lancet Commission on Global Mental Health and Sustainable Development that many people who previously coped well are now less able to cope because of the multiple stressors generated by the pandemic. All this is understandable given the many uncertainties facing people. The UN policy brief notes before identifying the growing use of addictive coping strategies, including alcohol, drugs, tobacco, and online gaming. WHO's Deborah Kestel said national data from populations around the world would appear to confirm this increased mental vulnerability, citing surveys showing an increase of prevalence of distress of 35% of the population surveyed in China, 60% in Iran, and 45% in the US. Much higher levels of depression and anxiety than normal were also recorded in Ethiopia's Amhara regional state last month. The WHO official continued, pointing to the estimated 33% prevalence rate of symptoms, a threefold increase compared to pre-pandemic levels. General symptoms caused by the COVID-19 include headaches, impaired sense of smell and taste, agitation, delirium, and stroke, according to the UN paper. Underlying neurological conditions also increase the risk of hospitalization for COVID-19. It notes while stress, social isolation, and violence in the family are likely to affect brain health and development in young children and adolescents. It adds that social isolation, reduced physical activity, and reduced intellectual stimulation increase the risk of cognitive decline and dementia in older adults. Alma?
All right. Thank you very much, Jim, for your update. Stay safe and stay healthy. We'll see you soon.
Thank you, Alma. Reporting for Geneva EBC Bureau, this is Jim Hipolito, and we live in interesting times.